The Q Morning Crew's Pink Fund McLaren Bay Region Breast Cancer Survivor of the Week this week is Paul Javitsky. Good morning, Paul. How are you?
Real good, thank you.
I know what you're thinking, Mid-Michigan. Paul's a man. Men don't get breast cancer. That's not true. We've been telling you this for years. 1% of the breast cancer cases are men. And Paul, you were part of the 1%.
I don't know if that's a good percentage to be part of, but that is correct.
As a woman, I know what I have to do every month to check for breast cancer. But men, how did you find out you had breast cancer?
It wasn't an easy thing to see, but I did feel a lump on my right side breast as I was just in the shower about 6 months ago, and I didn't really think anything of it for about a month or so. Then when it didn't go away, I thought to myself, I should probably have my wife take a look at it. So I pointed it out to her, and she said, well, it does feel hard, or it felt like some type of a lump was there. So that's kind of how I noticed it. And when I looked in the mirror, my chest around my nipple area, there was a dent in there, like something hit it with a hammer. It wasn't a very big dent, but it was obviously quite noticeable when you would look at yourself in the mirror.
Now, was there any pain involved with it?
None. None whatsoever.
Okay. You're in the shower, you notice the lump, you share it with your wife, and then you go in and you have it checked out.
Well, not right away, but my next visit to the doctor, which was about 3 months after, I do go to get, checked with my doctor on an annual basis with blood pressure and those types of things. So my appointment was probably a couple months away. So when I went there on my next scheduled visit with him, I discussed it with him, and he took a look at it, and he suggested that I get in to get a mammogram done. It's weird because when I was in that room with the mammogram place, obviously there was nothing but women coming and going from the facility, and I'm sitting in there waiting my turn, and my gosh, I seen 10 or 12 women coming and going, and I finally went up to the front counter, and I said, hey, I'm here to actually get one of these. Did you forget about me? And oh my gosh, they thought that I was waiting for my wife.
Oh, no.
Could have been getting one, but after they noticed that there was a mistake, they got me right in.
Okay. We're going to take a quick break. We'll be right back with Paul. He is our breast cancer survivor of the week. Coming up next.
Jim Kramer and the Q Morning Crew, 98 KCQ.
Back on the Q lines with our buddy Paul, our breast cancer survivor for this week. Yes, he is a man, and he is part of the 1% of men that will get breast cancer. So we know how you found it, the diagnosis, you had the mammogram. What happened next?
After everything was said and done, I had to go back to the doctor, and then she reviewed the test with me. And just to make sure that it was breast cancer, they did a biopsy, okay? Mm-hmm. So that was the next step, and within a matter of 3 days, they knew for sure what type of cancer cells we were dealing with. So that's pretty much how that went down.
So, Paul, your message to other men in Mid-Michigan when it comes to what you've dealt with?
When you're shaving in the morning or when you're in the shower, as you do different things, my lump was big enough to notice. And when I looked in the mirror, you will definitely see an indentation in your breast area. And if you see the indentation along with feeling a lump, have it checked out.
Paul, again, thank you so much for your time this morning and your willingness to speak to the men here in Mid-Michigan in regards to breast cancer. Continued good health to you, our friend.
All right. Thank you.